Marty was my friend, and it's going to take, I think, a long time to really feel what it means that he's gone. But he was also a colleague of mine for many years, and certainly, he was at one point in his life, he was a teacher. And I think that stayed with him for the rest of his life. He loved to teach people, and he loved to mentor people. And I think that in addition to the direct contributions, which other people will probably talk about, Marty also mentored and taught a lot of the activists how to be better activists and how to do their jobs. And so I think that his influence is so much bigger because of that. Nobody could speak like Marty in terms of public speaking. And, the one thing that I remember and will always remember so clearly was being on the road with him and doing these town meetings all over the country. And it was right after the studies of AZT had proven to be so negative, and people were really down on treatment, and there were people dying all the time, and people wondered what we were going to do. And that was just as the very first data about protease inhibitors became available to just a select few people, Marty being one of them. And what Marty talked about in every town that we went to was the fact that there were these new drugs that were called protease inhibitors, and they were doing something miraculous, that people were literally coming back from the dead. And what that meant, I think, for people with HIV was that there was something to hold on to and a reason for holding on. And I think that there are people that are alive today because of that hope that might not be alive.
Marty Delaney is somebody that I knew for about 20 years. I became an AIDS activist. At that time, I started working for the NAMES Project in San Francisco and became very aware of the work that he was doing through Project Inform, and kept hearing about the town hall meetings and some of his drug smuggling adventures. Marty was daring and adventurous on behalf of people with HIV, and he's really responsible for more and better services and faster treatment activism, and of course for the Parallel Track program. And I will always remember him for at least that.
I'm Ron Roseness with the Canadian Treatment Action Council in Toronto, and while I knew Marty peripherally for many years through Project Inform, last year I had the opportunity and privilege of basically being a fly on the wall and listening in on the conversations that Marty led as part of the Fair Pricing Coalition. And for me it was a huge learning opportunity and an ability to see Marty in action and to learn from him how far dialogue can go in reaching agreement with pharmaceutical companies. So Marty, I miss you, I learned from you, and I'm really grateful for the opportunity I had.
Marty Delaney helped to change the culture and saved countless numbers of lives in the work he did with others as an activist. He was a huge inspiration, and I was trying to explain it to someone who doesn't work in the field as saying, imagine if you'd been alive when the Declaration of Independence was written and signed. The first person who helped to write it, one of the first signatories, was gone. You couldn't see that person or talk to them or interact with them anymore. That's kind of what this is like for some of us in the community. And I'm grateful for the work he did and for the work that all my colleagues do every day.
When I was diagnosed April 1989, I didn't know what to do, who to call. I picked up the phone, dialed a number that I had no idea where it was going, and I couldn't swear to it, but I think Marty answered the phone, and he's the reason I'm still alive. In the 20 years since, it has been a pleasure to have known and worked with him and get to know him in ways that I never would have thought imaginable at 20 years ago.
About Martin Delaney, who was one of the most amazing communicators about very complex and very important information, treatment information for people with HIV. He was legendary, and when I first met him, I was just in awe that he had this way of reaching people with a message of, complex information, but also with hope. And he always said, and Project Inform stood for including this message of hope, which was very important. And the other thing that struck me is, and it really goes along with it, I always would hear him talking about, he would finish up a talk and he'd talk about the cure, how it's important not to lose touch with looking for a cure for HIV infection. And I thought was crazy at some point, is because there's it's just impossible. You can't do it. We need treatments. We need vaccines. But now that I'm working on understanding what's behind what will be needed to do research to find a way to actually cure HIV infection, it's not so crazy. And he kept that alive, and I'm very happy he did, because when no one was talking about it, he was. And maybe 10, 20 years from now, when we're able to do it, we can remember that he kept that alive.
It's always a challenge to speak of someone who you love when they're no longer able to be in the room. But for me, I really feel privileged to get to talk about Marty, because when I first met Marty, I was in Chicago and working in the Midwest at a time when the epidemic leaders were on either coast, and Marty never forgot us. And over the years, Marty and I had many arguments. We disagreed about who should be talking to whom on what occasion, and we also were challenged to think about who in the Black community could say the right things. But Marty and I always agreed on one thing, and that was that we had to do what Jesse Jackson said, and that was keep hope alive. We had to look at the work that was being done and who was willing to do the work, and not respect people, but respect the task in front of us. And I'll never forget speaking with Marty just a year ago. We were still talking about who should be speaking about HIV in Black America. We still didn't agree, but we still agreed on one thing, that we were going to keep doing the work no matter what it took.
And I remember the first time I met him, it was like Jesus on Palm Sunday. All these people around him. Not only did he have a message of hope, but he really had an agenda with the FDA, the whole public health service, with the NIH, and he really knew his stuff. He did his homework. He knew what he was talking about. He was a true leader. Everybody says pioneer, visionary, but I'm telling you, he really was.
I came to know Marty later in life and worked with him on the Fair Pricing Coalition, and with Positively Rare magazine last year, he worked with us on our drug guide. But I remember the first time when I felt kind of on a par, because for many, many years, Marty was the type of person that you kind of worshipped from afar, and you heard of him and you heard of his work, and then many of the good deeds that he had done and the work he had done, and it spoke for itself. But at one Fair Pricing Coalition meeting, I remember calling one of the pharmaceutical companies on one of the slides and pointing out an error in a calculation that they had done, and Marty turned to me and said, "Bingo!" And at that point, I kind of felt like I had learned, something very valuable that he had taught me. And that's the wonderful thing about Marty, was that to me he represented a great teacher, and he was very generous in the way he taught others.